Welcome, my friends, to Dr. Frank Cutting Edge Medicine. I'm your host, Dr. Frank Miller. Today, since we had a glitch halfway through our previous recording, we are going to try again, so please enjoy. Welcome, my friends, to Dr. Frank Cutting Edge Medicine. I'm your host, Dr. Frank Miller, coming to you from San Antonio, Texas. This show is sponsored by O3 Plus, our health, wellness, and longevity clinic located right here near the South Texas Medical Center. Our phone number is 210-558-7778. At O3 Plus, we tried to provide an assortment of complementary treatments to help your healthcare provider get you in the best shape possible. From ozone therapies in all its forms, vitamins, nutrients, light therapies, hyperbaric oxygen therapy, pulsed electromagnetic field magnet therapy, supplements, ozone oils, hydrogen therapy, saunas, and we also do bioenergy testing, as Dr. Schallenberger has promoted. The whole process is this. You make the call, 210-558-7778. Talk to Terry, our very friendly and knowledgeable receptionist, and get an appointment with our skilled nurse practitioner, Kim Engelman, who will hear your story, what's worked, what hasn't, and come up with a treatment plan to get you better. To get more information, visit our website at www.o3plustx.com. That's O3plustx.com. Or, again, call our number at 210-558-7778. The time for you to get better is now. Okay, well, we've been talking about the 5 main pillars of health: good sleep, good nutrition, regular exercise, detoxify, and de-stress. And all this is to keep our bodies functioning at optimal levels. And it all starts with our spirit. So let's pray. God, what a wonderful creation is the human body. Thank you for putting your spirit of love inside of it and creating us. And now teach us how to better take care of our bodies so that we may serve you by serving your people. And thank you for people like our guest today who are leading the way. In your holy name we pray. Amen. Well, everybody, I'm really excited to introduce our guest today. He is a physician, trained as a pediatrician. Then, the smartest doctors go into infectious disease, so that's what he did. And then somehow he ended up into complementary, alternative, holistic, and all kinds of other medicine, anything it takes to get you better. And he formed a clinic in California, and he has been doing this for about 40 years. So I'm 20 years behind him, trying to learn and get up to speed. His name is Dr. David Minkoff. So, David, welcome.
Thank you, Frank. I'm actually in Florida, not California.
I'm sorry. Didn't you train in California?
I did, but I've been in Florida for 30 years.
And that's in Clearwater, Florida, and that's where your clinic is?
That's correct.
Okay. Very good. And that clinic, what's the name of your clinic there?
LifeWorks Wellness Center.
Okay. And if people wanted to get in touch with you, is there a web page or something there?
Yes, they can go to LifeWorks Wellness Center, all one word, .com, and there's got thousands of pages on there of information about the clinic and videos and anything they'd want to know.
Excellent. So I met David again at the American Academy of Ozone Therapy meeting a couple of weeks ago, and we got to talking about his book that was published, I think, a couple of years ago, and it's called The Search for the Perfect Protein. So tell us about your journey and how you came to writing this book.
Yeah, I took up a hobby in 1982, which is doing Ironman triathlons. So, that's a race where you swim, bike, and run. The swim portion's 2.4 miles, the bike portion's 112 miles, and the run portion is 26.2 miles.
Wow.
And I've done 43 of them so far, and there's other races where you do like half that distance, and I've done a few hundred of those. So I was interested in athletics and performance. I was a vegetarian, and I found that I was breaking down, and I couldn't heal myself. And one time I was running, and I pulled a hamstring muscle, and I could not get it to heal no matter what I did. I took protein powders, and I got massage, and I got injections, and I got chiropractic, and I got pulse magnetic field therapy, and I got homeopathics. I did everything, chiropractic, and it wouldn't heal. And I did some extensive blood tests, and one of the tests I did was the amino acid levels in my blood. and I found that they were all low.
Even you, an athlete.
Well, me an athlete, but a vegetarian athlete.
Okay.
So I wasn't eating meat or fish, and I wasn't able to get enough protein from my food to keep up with my activity. And so I started to search around to see, could I find something that would help me get my amino acid levels up. And I put together a combination of amino acids. Now, amino acids are the building blocks of protein. There's 22 amino acids, but 8 of them are what called essential, which means you have to have them.
Mm-hmm.
And if you don't really have to have the non-essential ones, but you have to have the essential ones.
And that's because the body doesn't make them.
Well, that's right. The essential ones the body doesn't make. So unless you get it from your food or your supplementation, you're not going to get them. One of the myths that people have is that they think that by taking collagen, they're going to build muscles and improve their bodies. But collagen is missing one of the essential amino acids. And it's also got too many non-essential amino acids. Like there's a lot of 2 amino acids, proline, hydroxyproline. The body can't really use these. So, people think that they're taking this and that they're going to get better from it, but really it doesn't work. So I searched around and came up with a mixture of 8 essential amino acids, which when we tested it, we found that it was used better to make protein in the body. Now, protein is your muscles and your tendons and your ligaments, but your immune system, all the enzyme systems, so energy and detoxification, and immune cells are all made out of protein. A lot of the brain neurotransmitters are made out of protein. So serotonin and dopamine and epinephrine, these are all based on amino acids. They're proteins.
Wow.
So I found that if you put together this combination, and I started using it, and I had within 6 weeks, my hamstring actually healed. Like the soreness went away. I could do hard runs. And I went to an Ironman race up in Canada, a very challenging race, and I had my best time ever. And I wrote an article in Triathlete magazine about my experience, that I thought I was eating well. I was a doctor. I was careful about my nutrition. I was taking supplements, but my nutrition was actually off. I was amino acid deficient. And so I got letters from 3,000 people who read this article.
Wow.
Now, I already had a nutrition company, and aside from the practice, and we started offering the product through the nutrition company. And now we sell, hundreds of thousands of bottles of this stuff to people because it really makes a difference. Very few people, I don't know if you do this in your clinic, but I do. Genova makes a panel called an ION panel. Mm-hmm. ION stands for Individual Optimized Nutrition. It's kind of like their NutriEval.
We've done that. Mm-hmm.
So we do it on every patient, and I find that almost all patients have amino acid deficiencies. All sick patients have amino acid deficiencies. All autoimmune, Parkinson's, chronic fatigue, Lyme, they all have amino acid deficiencies. I've worked with some very high, very Olympic caliber or professional caliber athletes. And when I tested them, I found that they're amino acid deficient too. And that if we add the amino acids to their program, they get improvements. So we're using these, and so out of my experience with really thousands of patients, because we found that some people who were hypothyroid, well, thyroid hormone is made out of an amino acid called tyrosine. And I would do the amino acid panel, and I would find that their tyrosine level was low, and that if we replaced the tyrosine, and usually what we do, the essential amino acid that tyrosine gets made from is called phenylalanine. Mm-hmm. So in the 8 amino acids is phenylalanine. The body will then make tyrosine out of it. And then some people didn't need thyroid hormone because they weren't making it because they were amino acid deficient.
Wow.
And so people with hair growth problems, or fingernails are weak, or they're chronically tired, or they're anemic, they need amino acids. And a lot of people, then we started measuring neurotransmitters in people. You get people who are depressed, or they can't sleep, or they're anxious. And their amino acid levels, their tryptophan levels, or their amino acid levels that would go to these neurotransmitters were low. And when we gave them amino acids, their depression, their sleeplessness, their anxiety improved.
Wow.
So I've had, and I've had even little babies. In my past life, I was a pediatrician, and I ran a neonatal intensive care unit. So I had a lot of experience with little babies. And after a couple of years into this, I had a mother who brought up her 8-month-old child, got a day pass from Children's Hospital in our area. The story on the child was that he had been born with his stomach open, like the skin and the muscle and the fascia that's over the abdomen had not closed. So at birth, his intestines and his liver were hanging out.
Wow.
And of course, he had emergency surgery. They stretched him so that the skin would fit, that they could cram everything else in there. But it was so tight that his intestine wouldn't work. So he couldn't eat. So they had him on intravenous hyperalimentation, on intravenous nutrition, for about 7 months. And then what sometimes happens is he got hepatitis from the mixture that they were giving him. And they couldn't give it to him anymore, so he couldn't get fats and proteins from that. And so she was worried about him, and at 8 months, he weighed the same as when he was born.
Wow.
So the kid was in a lot of trouble. She brought him up for a day pass. I gave her some of these amino acids. The product is called Perfect Amino. A tablet is 1 gram. It's 1,000 milligrams of amino acids. If you calculate the dose needed for an 8-pound kid, like a 3-kilo kid, it's only about 1.5 grams is what his protein need is. So I gave him a half a tablet 3 times a day. They crushed it up. They put it in a little bit of honey with water, and they dropped it into his mouth. And he was able to tolerate that volume of liquid because he really couldn't eat very well. And he started to gain weight.
Wow.
And he gained as if he was an infant getting, let's say, breastfed. They'll gain a pound, sometimes 2 pounds a week. And by the time so he then was able to get out of the hospital. And by the time he was 2 years old, he was normal size. And he was a normal kid. So even in little people, it makes a difference. There's a guy that owns a nursing home in Hawaii, and the nursing home is for Alzheimer patients. And so he heard about the product, and he started giving it to patients. He started giving him 10 tablets, which is 10 grams, or 2 scoops. There's a powdered version of it, every day. And 30% of his patients within 4 months recovered their mental faculties or their ability to do self-care, like they were too weak to bathe or get dressed or do things like that. And they were able to leave the nursing home.
Wow, you think of the implications of that. I mean, nationally, we could keep so many people more independent if they just had the right nutrition.
Right. So, as I said, in sports performance, there's hundreds, if not thousands, of success stories on our websites from athletes who got injured, couldn't recover, or were chasing performance and they just weren't quite there. And then they had a Perfect Amino, from hockey skaters to triathletes. There was a triathlete who had won the Ironman World Championship twice, and he was going back to try to do it a third time. And so he heard about the product, and we got together with him, and so I supplied him with the product, and he took it for about 4 months. And the Hawaii race is always in October, and he would always go to Hawaii. It's the big island on Hawaii is where the race is. He went to the race always about 3 weeks early, and to test his fitness, he would do a 150-mile bike ride in the mountains there to just see how he was feeling. Wow. And he'd done this for like 7 or 8 years, so he knew what a good time was for that mileage. And so he told me he's going to Hawaii, said, keep taking the product. He calls me when he gets home from the 150-mile bike ride, and he's in a panic. And he said, I did this 30 minutes faster than I've ever ridden this 150 miles before. He'd done it like 8 or 9 times.
Wow.
He said, there must be drugs in this stuff. And I don't care, because they're going to drug test me if I win the race. And there's no drugs in it. And I went over and I watched him race, and he won his 3rd Ironman World Championship. And, he testified that, the product had made a huge difference because he could train harder. His recovery was better. But we find this with, menopausal women too. Like their energy's better. It's a needed nutrient that is mostly neglected by people. And part of this is because many people have disordered digestion. They're taking drugs that block stomach acid, so you can't digest protein. Many people don't have enough enzymes. Many people have yeast or parasites or SIBO, small intestinal bacterial overgrowth, and their intestine doesn't absorb well. And so this product is absorbed starting in the stomach. If you take it within 23 minutes, it's in your bloodstream. So the book, The Search for the Perfect Protein, really is about this story, many stories about people that I worked with who use the product, and then try to give people an understanding of like how does this work and how could you use it to help yourself. Mm-hmm. And so it became an Amazon bestseller. There's been many thousands of copies sold, and so it's not a textbook. It's written for lay people so that they can understand how their body works and why amino acids would help them, and then they can try the product and see. The product has a money back guarantee. We don't get anybody wanting the product, wanting their money back. The stuff really works well.
That's amazing. So, why would not just eating a steak do the same thing? What's the difference?
Well, if you had normal digestion, I think we live in abnormal times. And probably 100 years ago, people weren't protein malnourished. They could eat a steak and they could get the nutrition out of it, because ideally that's what you do. But so many people now don't digest it. They don't absorb it. Their intestines aren't any good. Plus, today you got to find a steak that's decent. These animals are mostly fed corn and soybeans, and they're genetically modified, and they're full of glyphosate. And so most of the steak that you eat, corn raised beef, blah, 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 you don't want to eat that kind of food because it's poisonous. It's full of glyphosate, and it's full of chemicals, and these animals are given hormones and they're given antibiotics, and those things are in the meat. And, cows are supposed to eat grass, and if they eat grass, they have the right balance of omega-3 and omega-6 fatty acids. If they eat corn, they have way too many. It's like 30 times the amount of omega-6 fatty acids relative to omega-3. So it's not a good food. Mm-hmm. And then, I think there's like 24 million prescriptions of Nexium and Pepcid and Zantac written every month, and then now this stuff is over the counter, and people have indigestion. They don't have enough digestive enzymes or hydrochloric acid in their stomach. They get heartburn. They take these drugs. They block protein digestion. So you can eat the steak, but you're not going to digest the protein, and you're not going to get the benefit of it.
Let's focus on that for just a minute, because I want to make sure everybody understands that in order to break down a steak or a chicken, even if it's organic, grass-fed, or free-range, you have to have acid in your stomach for the enzymes to break. They kind of uncoil the protein, right, to get the amino acids out of there. And so many of us don't have enough acid. Why don't we have enough acid these days?
I think it's a nutritional efficiency. I think in order to make stomach acid, you need amino acids, which people already don't have. You need zinc. You need iodine. There are pathways where the stomach is able to do it, and most people over 40 don't make enough stomach acid if you measure it. And we find a lot of people, even young people, they're not making stomach acid. I think it's nutritional. I think it's a mixture of nutritional deficiencies and then environmental toxins. So the pathways get blocked and their stomach can't do it.
And the other thing you mentioned in the book was why are they even taking the acid blockers? They're getting reflux, but the muscle at the bottom of the esophagus has to have a pH of 1 to 2 or a very acidic condition to work, and we don't have that, and so now you're splashing a pH that's still acidic up into your esophagus, and so it makes you feel like you need an acid blocker, so you take an acid blocker and it makes the whole thing worse. Is that right?
That's right. And most people in that circumstance, if they took hydrochloric acid, if they took a supplement like we have our company's called BodyHealth. We make a supplement called Full Spectrum Digest. And so it's digestive enzymes that you need to digest proteins, fats, and carbohydrates. But it also has hydrochloric acid in it. And we find that if you take that with the food, that the acid level in the stomach then activates the pepsin, which is the digestive enzyme needed to start protein digestion. But then the stomach is also acidic enough so that valve that's between the esophagus and the stomach will close, and their heartburn gets better. Their reflux goes away. Because really they were missing acid. And what most of the gastrointestinal guys are doing, and what you see on TV, is if you take buffers, if you take things that block stomach acid, well, your symptoms will go away, but now you're going to get stomach cancer, you're not going to digest your food, you're going to get small intestinal bacterial overgrowth because, God didn't put stomach acid in there for nothing. It's got a purpose and it's got a reason. And if you mess with it, you're going to have trouble, which a lot of people do.
Yeah, it makes a lot of sense. When that was kind of a light bulb in my head when you said you needed more acid, and I thought, well, how do you get it down there? But you have it in a capsule or something, so you don't burn your esophagus on the way down. And then once you have the right acid, then you can make from the food that you eat, you can actually start to use the protein that you're eating to rebuild your body, your gut, the mucosal lining of your stomach, and all the other things. So that's pretty amazing. What about so? If a person has a problem with their stomach, though, what you're saying is with the perfect aminos, since they're already broken into amino acids, they can get absorbed in spite of not having the proper acid or the digestive enzyme initially. Is that right?
That's right. Because, if you take that steak, the protein in steak, the muscle protein, is made up of most of the protein is called actin. That's the protein that makes muscle. Actin has 5,600 amino acids per muscle fiber. So it's a very long, complicated protein. You can't, if you chew up the steak, so it's you liquefy it, you keep it in your mouth and you chew it so you're not swallowing chunks of meat. You have it really broken down. And it goes into your stomach. The digestive enzyme in your stomach, pepsin, which is activated by the hydrochloric acid, chops this long chain of 5,600 amino acids into much shorter chains. And then when it goes into the small intestine, digestive other enzymes, trypsin and chymotrypsin, they break it into individual amino acids. So you start with a big glob that's for one fiber of 5,600 amino acids. By the time it gets to your intestine, it's single amino acids, which are absorbable by your intestine. Mm-hmm. And they will go right in your body. If they're too big, the body won't take them and they don't get them. So perfect amino is already in that broken down form. It is in the amino acid form. And the test that we did, we found that if you took it on an empty stomach with a glass of water, that we could measure the amino acids in your bloodstream in 23 minutes. So it's absorbed very fast.
So if you're going to be, say your athlete who was doing the triathlon or the Ironman in Hawaii, does he take it before he exercises or the night before, or what's the best?
They take it every day. They take it before exercise. we have an electrolyte mix now too that's got a couple of 1,000 milligrams of the amino acids in there. And so you take it with sodium and potassium, magnesium, zinc, and trace minerals, and they can be taking these the whole time. I usually drink, a scoop of this every hour on one of those races, and that keeps me hydrated, it keeps my electrolytes good, and it keeps my amino acid level high, which actually has an interesting effect on the brain, where the brain doesn't feel then that you're deficient or that you have to be it sends, if the brain thinks you're overstressing, it will decrease muscle performance.
Huh.
And so if you keep the amino acid level high in the bloodstream, you don't get this reflex effect, and the muscles will continue to perform at a high level for the whole time as long as everything else is okay.
So so that was 1 gram per tablet or 1 gram per scoop? No, is it 5 grams per scoop or 1 gram?
5 grams per scoop, 1 gram per tablet.
Okay, so how much does the average person need? Say a recreational athlete.
I just tell people take either 2 scoops in a glass of water when you first get up in the morning, or 10 tablets, and for most people that's enough. Then eat, if you're a vegetarian and you're not eating animal protein, you need another either 2 scoops either once or twice a day, because you really don't get the amino acids that you need. I have tested hundreds, if not thousands, of vegetarians, and when the amino acid panel comes up, you can see right away. I can just look at them and say, "You're a vegetarian, aren't you?" Or "You're a vegan," because their profile sucks. It's really low. Mm-hmm. There are a few vegan vegetarians who have a microbiome. They have the intestinal flora that's probably more like a cow than it is a human. And those bacteria in their intestine can manufacture the amino acids that they're not getting. They can manufacture essential amino acids that they're not getting from their diet. And so you will see occasionally bodybuilders who are really well muscled, and they're raw vegans or they're vegetarians, and they are making amino acids, but it isn't because of their diet. It's because of their microbiome is very unique. But the vast percentages of them, they don't have it. And they're tired, and their hormone levels are low, and they get doughy because they're on a high-carb diet, and their bodies don't feel well. And so if they add essential amino acids, it will make a huge difference, like Perfect Amino, to how they feel. And they will feel it. They'll feel it within hours to days of like, wow, my body wasn't getting this. And the product is vegan, so if that's your philosophy or if that's what you want, there's no animal anything in this product. It's all it's from vegetables.
If you just joined us, we're on the Dr. Frank Cutting Edge Medicine Show. I'm your host, Dr. Frank Miller, and we're talking to Ironman Dr. David Minkoff about his book, which is called The Search for the Perfect Protein, and the product that he has, which is called Perfect Amino. You can get these things on the website, which is BodyHealth.com. You can go there and look around all these different things that he has. So we're talking about trying to get optimal health with nutrition, which we talked about a lot before. And today we're focusing on proteins, because the proteins are super important for your intestinal health, so you can absorb all the nutrients that you eat. We were just talking about the importance of having the right nutrients, the ones that don't have Roundup or glyphosate on them. Grass-fed beef would be ideal. I mean, as organic as possible. And then try not to have heavy metals and other things that are in the environment, in their pesticides and whatnot. So all these things, not just for an Ironman or an athlete, but there's so many chronic diseases that we have found are related to nutrition, and that's what we're going to focus on a little bit more. So tell us some stories about people. You mentioned the nursing home and the Alzheimer's people who got better, and that was in as little as 3 months, you said?
Yeah. And myself, it was 6 weeks for me.
Wow.
My torn hamstring, it wasn't really torn, but it was very strained.
Well, and the same thing for me. I play racquetball 3 times a week, and I'll get a little pain in my knee. But once I started using your product, it makes a big difference on how fast you heal, and you're able to get back to to better performance so much faster. One of the things I think they've been talking about with an older population in the country is you don't want people to be tearing themselves down at the gym and not be able to get back to it. And, you tell a 60-year-old it's time to go exercise, and they go to the gym and they go crazy, and now they're got tendonitis or they tore a muscle. And so this is something that can help them to, hopefully they'll go with a little more moderation, but they can get back to their fitness schedule a little bit quicker. So that's important.
Yeah, I mean, another big area is osteoporosis. Like the amount of osteoporosis in the aging population is huge. And the sort of Osteoporosis Society says, oh, take your Citracal, you need calcium. And really, I've never seen anyone that's been deficient in calcium. A bone is made out of a protein structure, which is collagen, that minerals get added to. It's kind of like the way they used to make walls, like a lath and plaster wall. They would put up this lath, which is little strips of wood, and then they would slap the plaster on top of it so that it would stick. Mm-hmm. And that's how a bone is made. The bone is about 50% protein, so this bone matrix gets laid down. It's a collagen. And on top of it, the mineral goes. So calcium, phosphorus, a few other minerals get laid on top of it. Now, as people age, if they're not moving their bodies correctly, if they're missing vitamin D and hormones, they are in magnesium, they are going to, and not enough amino acids, their bone is going to break down because the collagen breaks down. And you can take all the calcium that you want, but if there's no matrix there, there's no foundation there, structure there for it to stick to, it won't stick. And it'll just give you kidney stones.
I think it's amazing that nobody really talks about this.
No.
They just talk about calcium and stress-bearing exercise, but if you don't have the amino acids in there, it just isn't going to work.
That's right. And so we found with lots of people, so their hormone levels are low, give them some hormones. Their D's level low, give them D. Their mineral levels are low, and then give them amino acids. And then give them some kind of program where they're lifting weights, their squats or dead weights, or they get on a vibrating machine. They do something, they walk, where the bone then has an impetus to regrow and reformulate. Their osteoporosis goes away. They start building new bone. They don't need to take the bisphosphonate drugs, which are dangerous. They're dangerous for the stomach. They're dangerous for the bone, for the jawbone.
Right.
So, I don't use these drugs ever, and I try to get people off of them because they don't really work. You don't get a real bone. You get what looks like bone on a bone density, but it isn't good normal bone. It fractures easy, and it isn't good. So you can do this nutritionally, and it doesn't take that long. Within 6 months, you can show improvement in bone density, but they need amino acids. So that's another, it's a huge area of health for people. So
what do you think about, we talked about on a previous show about blood flow restriction bands. Have you ever used any of that in your training?
I do. I use it.
Okay. It has some pretty interesting science behind it from the Japanese.
Yes. Yeah.
Okay.
No, I do it. I have bands, and for my weight workouts, I use it.
And what do you think is the best schedule for people who want to be in good shape? I mean, I've heard aerobics for 3 days and weights for 3 days or something like that. What's your feeling?
I think for your average person, if they do, that's exactly what they do. Take Sunday off, and then Monday, Wednesday, Friday, do something aerobic. They can walk, they can swim, they can ride their bike, they can play tennis. They do something like that where they're going to get sweaty and get out of breath and use their muscles. And I think on the odd days they can do anything from weight machines to body weight exercises. If you do push-ups and sit-ups and pull-ups or stretch bands, it doesn't really matter. The muscle has to be stressed, so you do it. I think for most things, if you do one set to failure, and if you've got the bands on, it doesn't take that many reps.
Right.
You will get the stress that the muscle needs to grow, and I've seen very fast increases in strength in myself from using the bands.
Mm-hmm. Yeah, I was watching the Katsu videos, and they were mentioning the importance of getting to that point where you make enough lactic acid, and then that released more growth hormone, anabolic hormones, and that's what really did the trick. But also it was releasing or producing brain-derived neurotropic factor, and I think that's why they're really emphasizing it to help prevent Alzheimer's, dementia, because that helps to grow neurons and keep the neurons healthy and everything like that. So that's good. What about detoxification? I know you make a couple of products. There's a metal-free and a body detox. What are those things?
So before I do those two things, let me just say that the whole detox pathway, so your liver and your kidneys and your lungs, the areas where detoxification takes place, these are all amino acid-based enzymes. And if you don't have enough amino acids, you're going to detox slow. This ion panel measures your detox pathways, and if you don't have methionine and glycine and these other, and glutathione, which is a 3 amino acid mix, you're not going to detoxify very well, and the environmental toxins are going to get in your body and they're going to poison you. So you need to have extra amino acids in order to detoxify. I found in then my heavy metal toxic patients, so mercury, arsenic, lead, cadmium, aluminum, these things are all over the environment, and most of us have high levels. And that if you give someone with their detox program amino acids, that they would detox about 40% faster. Like it goes faster because they got amino acids and the thing moves faster. Now, I got into this business because my wife's a nurse and she's also a triathlete. And she decided in 1995, after going to some lectures from Jeff Bland and a few other people who are kind of mentors in our business, that the mercury fillings in her mouth, the silver fillings, which are 50% mercury and then the rest is made out of silver, tin, and copper, that they were bad. And so she went to a local doctor here, a dentist, and she said, take them out, and he drilled them all out. There's no protection for her. And so you take a high-speed drill and you drill this out, mercury boils at 110 degrees. And believe me, those fillings get up to 110 degrees, and they're aerosolized, and they get all over your body. So modern natural dentists have a protection for you. They put a thing in your mouth so you can't get contaminated with this, and special suction so you're protected. It is good to get those things out of your mouth, but you have to do it with a dentist who knows what they're doing. So, but when she did it, it was early, it's 25 years ago, and nobody knows what they're doing. And this guy certainly didn't know what he was doing. And so she got a big mercury spill. She got a big mercury contamination. And it led to an autoimmune condition where the mercury got in her thyroid and she got autoimmune Hashimoto's thyroiditis. And it got in her liver and she got hepatitis. Her liver function test went high. And one morning she wakes up and she can't lift her arm, and her glute muscle's weak. And by this time I'm an emergency room doctor. I'm in a big community hospital. I know all the good doctors. I had her see the thyroid specialist and the liver specialist, and they said she's got some kind of autoimmune. We don't know what's wrong with her. And then I had her see the neurologist because of the weakness. And he said, well, she's probably got MS. We should start her on some steroids and some interferon. And these are big drugs, and they're not nice drugs. And I was like, something is wrong with this picture. And so I started looking around like this isn't adding up for me. I don't know anything about this area. I'm a good emergency room doctor, but I don't know anything about this. And just by accident or by serendipity or by grace, a natural dentist moved in to my wife owns a home healthcare nursing business. So she sends nurses to people's homes for dressing changes and meds and stuff like that. And a dentist moves in right next to her in the office complex. And on the marquee, it says natural dentistry. And in the middle of this whole thing with her, one day, I drove over to pick her up after work. And I saw the marquee, it says natural dentistry. And he was coming out of his office. And I said to my wife, just hang on a second. And I went up and introduced myself to him. And I said, hey, what's natural dentistry? I'm a physician. My office is over here. And he said, well, most dentists don't believe or aren't educated that the mouth is actually in the body. And they do things in the mouth that you'd never do in the body. So they put mercury in the body. You know, they put mercury in these fillings thinking it's okay. But he said if you took one of the fillings, one of the silver mercury fillings, it's about 500 milligrams. It's not much. And you ground it up. And you put it in a 10-acre lake that has fish. The mercury disperses into the lake. It gets into the fish. That if you went fishing there and you caught the fish, that you wouldn't be able to eat it because it's too mercury toxic. They would put a fish advisory on that lake. That's one filling in 10 acres. Now, your mouth is, I don't know, a millionth of an acre?
Something like that.
Now, these things off-gas. When you eat something hot, remember, mercury boils at 110. Body temperature is 98. So 12 degrees, not much. Hot coffee's 160, 170. I've got a hot water warmer upper at home, and it tells you can set the temperature you want the water. If it's boiling, it's 212. If you want it hot enough to make some coffee or tea, I usually put it at 160. So it's plenty hot. You can't really drink it at 160. But people get coffee, and so they drink it at 140. But the mercury boils at 110, so it comes off. It off-gases out of their teeth, and it goes into their palate, and they swallow it, and it goes into the nerves in their palate, and it goes into their brain, and we get poisoned with this stuff. So he says, so I tell him, he said, you know, we would never do root canals because root canals, you're basically taking a dead infected tooth and you're leaving it in the person's mouth. You kill the nerve so they don't feel it. But he said, find me a surgeon that would ever leave a gangrenous toe on someone. Right. A dead infected toe. It'll kill them. I just had somebody last week that they had a terrible belly ache, and I had to send them to the hospital. And when the surgeon opened up, they had a piece of dead bowel. The artery had gotten a clot in it that went to a portion of their large intestine. Now, he could not leave a dead infected bowel in there. The guy would die. Right. Okay? He had to cut it out. So you leave a dead infected tooth in, you're going to kill the guy slowly or quickly, but you're going to kill the guy. It's no good. It's terrible medicine. And nobody would ever do it, but dentists do it all the time. So I said, well, gee, what you're telling me is really interesting. And then I told him the story about my wife. And he said, oh, she's mercury toxic. But nobody around here is going to help you. So he said, there's a guy in Seattle, and he teaches doctors, and you better go there. And so I went there, and I learned from him this whole area and came back and then treated her. And I started using the regular chelators like, you know, EDTA and DMPS and DMSA. But I found that they were just pretty toxic, and people would be holding their kidneys, you know, after they got the treatment because the heavy metals would get stuck in their kidneys. So I started to work with a biochemist to say, could we find an oral form that would chelate out heavy metals, that was safer, that you could control the dose, and that actually the way it turned out, it doesn't remove good minerals. So it doesn't deplete you of calcium and zinc and magnesium. Part of the problem we see with the regular chemical chelators, with the pharmaceutical chelators, is people get deficient. Right. You know, they get low calciums and low zincs and low magnesiums. And sometimes you can't replace enough orally to keep up with them. So the first product that I came up with is called, we call it Metal Free. And it came on them, you know, and I used it on her, and all her symptoms went away. Within about 5 months.
About how many months?
About 5 months. Mm-hmm. So all the weakness went away, and the Hashimoto's cleared up, and the liver cleared up, and she's now, you know, it's 25 years later. She's still a triathlete. She's, you know, she looks amazing, and she's got great health. So all this is sort of like water over the dam. You can fix it. So there have been, I don't know, 100,000 at least bottles of Metal Free. And then we did a companion product called Body Detox, so we could detox chemicals and pesticides and the other stuff in the environment, you know, glyphosate and other DDT and things like this that are in the environment and they're getting into our bodies, and that you could detox someone. And these are sprays, so they're easy to dose. You can give them to children. You know, it's a sublingual spray, so it goes underneath the tongue. It's absorbed right under in the mucous membrane. And you can use these to get your body free of these heavy metals and these toxic chemicals. And then if you combine it with with perfect amino, you can, and then we always give a binder with it. So, you know, either chlorella or Pectisol or charcoal, so that you can bind this stuff, that you can clean somebody out of these things and you can really improve their health.
So when you say bind it, then it binds it and then it goes out through the intestine. So I think you had mentioned before about the importance of regular bowel movements as well.
Oh, yeah. I mean, most of the chemical chelators, most of the stuff comes out through the kidney, and that's why these people were holding their backs, because their kidneys were being inflamed. So this is 99% comes out through the bowel, which is where you want it. So, but you got to have a bowel movement every day. So if you're not having a bowel movement every day, you're going to be sick anyway. Mm-hmm. So my rule for everybody who comes in, and it's funny because, you know, people grow up with bowel habits that they think are normal, and you'll say to someone, well, what's your bowel habit? I always ask everyone when I first see them, you know, what's your bowel habit? And they'll say, oh, it's normal. So how often do you go? Oh, at least once a week. Really? You know, really? I found the worst people. You know, you get someone comes in a wheelchair and they've got a diagnosis of MS or ALS or some horrible neurological disease. It's usually a nurse. And I just had this happen. I said to her, so she's in the wheelchair. And I said, she's been in a wheelchair for years. And I said, she says, I've got a diagnosis of MS. I'm coming to your clinic because I've heard that you help people. So I said, well, what's your normal bowel habit? Just like offhanded, I'm just talking to her while I'm doing my exam. And she said, oh, it's normal. Really? Okay, good. Like, how often is that? She said, usually once a month. Sometimes it's 3 weeks.
Oh, my gosh.
And I said, really? She said, yeah, ever since I was a kid. That was just how it was. And I thought it was normal, and my body got used to it, and and it's like, holy smokes, you know, if the stool's not out in a day, guess where it's going? It's going right back in. Mm-hmm. Just get your poison yourself with your own waste. There's no way that you could be healthy that way. So my rule is at least daily, and I find I go 2-3 times a day.
And do you think
fiber, you'll go.
That was my next question. So how do you get it moving better? And it's probably more vegetables and fiber, right?
It's vegetables and fiber. We make a product which is to help people go, but it's sort of bowel stimulants. I find magnesium. We make a product called Calm, which is magglycinate with a little vitamin C in it, and mag citrate, and it stimulates the bowel to go. So I usually give them that, and I say every night before you go to bed, put a scoop of this in hot water and drink it down. And if in a couple of days you're not going every day, then put 2 scoops. Mm-hmm. And if it makes you too loose, take a half a scoop.
Right.
And it's a habit I have every night before I go to bed. I take a scoop of this stuff. I think it helps relaxation. It helps sleep. 3/4 of people that we measure, they're low in magnesium anyway, so they need it. And it gets people going. And it's not extreme, and it almost always works.
Mm-hmm. Yeah, I think that's what I found also is most people have plenty of calcium and not enough magnesium. And I think that's because they're not eating as many vegetables. At least that's what it used to be. But now that you have the glyphosate out there, the Roundup, it chelates a lot of that stuff. It stays in the soil. The vegetables just are not like they used to be when our grandparents were eating them. So, yeah.
Well, that's right. I mean, the glyphosate causes, we say this thing like you have a leaky gut, like your gut membrane doesn't hold in the things that you're not supposed to get in your body. And glyphosate causes plant roots to leak, so they don't absorb properly. They leach out things that they're supposed to have. And so the concentration of, carotenoids and minerals and vitamins that are supposed to be in the plants that we eat are levels that are maybe 50% of what our moms and dads had or what we had when we were little. So it is a problem. In organic produce, it's much better, but in the regular produce, it's not bad. It's terrible. I mean, I would, some places where they have, you can go. I was in Italy before the COVID thing, and I couldn't believe how good a lettuce salad tasted, and what tomatoes tasted like. Like, wow, this is really an experience, a pleasure experience of these things. And most of the stuff, I mean, I am, 98% organic. We eat out occasionally, but mostly. But the stuff just doesn't taste as good as it did over there.
Mm-hmm. Well, now they don't allow glyphosate over there, I don't believe, right? That's what I heard.
Some places, well, it's not universal. It just depends on where the stuff is grown.
Okay, we got about 5 more minutes, and I wanted to kind of touch on obesity, because that's a big problem here in Texas for a lot of reasons. Inactivity, Mexican food, genetics perhaps, and I think the perfect amino can help us with this because, a lot of people, they just either want to skip a meal and then you remain protein deficient, or they're just not really sure what kind of things to put in their smoothie. They're putting a whole bunch of different types of protein powders, but they're in the wrong ratios, and so if you have too many of the wrong amino acids, then your body just clips off the amino group, and now you got a carbohydrate, your insulin levels rise, and you actually gain fat weight. So how do you counsel your patients on weight loss and things like that?
Well, my first go at them is I put them on the anti-Asian, anti-Mexican, anti-South American diet. Because all those cultures, anti-Middle Eastern diet, all those cultures are full of high carbohydrate vegetables and grains. And it's very hard to lose weight when you eat that way. Okay. Most people, if they have green and red vegetables and proteins, meat, fish, and eggs, they will control their insulin. Insulin, of course, when it goes up in response to a carbohydrate. So if you have, I'll give you an example. I wear a continuous glucose monitor because I'm tracking my glucose all the time. And I can see what a meal does to my glucose. And if I go, so there's a Mexican restaurant near my office which has fresh, really good food. And if I go there and they make me a bowl, what they normally do is put rice on the bottom, but I don't eat rice. So I have them put cabbage on the bottom. And then they put guacamole and cilantro and pico de gallo, and I have them grill up some shrimp. And if I eat that meal, my blood sugar will go up about 10 or 15 points. So if my baseline blood sugar is about 90, it'll go to 105. It'll come right back down. I am not getting a big insulin response to that, and I am not going to store fat from that meal. Mm-hmm. If I go into the same restaurant, and I've done this experiment a couple of times, and to the thing that I just did, I have them put a scoop of black beans. My blood sugar will go to 155.
Wow.
Just the beans. So I can't eat beans. I actually like beans, and I think there is some good nutrition in beans. But if I want to keep my body fat low and I want to keep my insulin low, I can't eat those foods. So I think if people, and I've found that the green and red vegetables, so radishes and tomatoes and all the leafy vegetables and broccolis and things like that, you can eat all you want. Mm-hmm. And you can put some oil on, you can put some olive oil on it. And if you eat the regular protein, so meat, fish, and eggs, that your blood sugar isn't, and you're not going to store fat. And if you are fat and you're keeping your calories in a reasonable range, 12 to 1,500 calories, unless you're moving around a lot, mm-hmm. that people will lose weight. And they got to move, they got to move 45 minutes a day. Mm-hmm. So that they will lose weight. We have a program at BodyHealth called Optimum Weight Reduction, and it's got some homeopathics which turn the pituitary on and some other glands on to help you burn weight. And we use Perfect Amino with that. and people lose weight like really well, and it works really well. So if you're sort of desperate and you want a quick start or jump start your program, that's the way to do it. It's 21 days, and it really works. So I think it's doable, but you got to get people. You can't have any packaged foods. You know, you can't have any fast foods. You can't have any poisonous foods. You have to eat fresh.
Yep.
And that if you start to do this, and then you take a good multivitamin, and you take Perfect Amino, and then if you need digestive enzymes, you take the digestive enzymes and a probiotic, so you start to help your gut. That you can lose weight, and your energy will come back, and you'll start to feel better, and things like blood pressure and cholesterol and all this other stuff. That it'll just go away. It'll get better. I put someone on a paleo diet, which is basically what I'm describing, that in 6 weeks, almost everybody loses weight, 4 to 8 pounds in 6 weeks. Their blood pressure comes down. Their energy comes up. Their sleep gets better. Their aches and pains go away, and their GERD goes away.
Wow.
And I put them on a digestive enzyme, our full spectrum digest, a probiotic. We have a probiotic that's half bacteria and half spore. And Perfect Amino, and I do add some extra greens. We have green and red powders. Add those, and it's almost every one. And these aren't big, expensive interventions. They're very minimalist.
Yeah.
But we're just giving the body what it needs, and you're sort of taking away all the garbage that people take in.
Yeah, absolutely. Well, listen, everybody, we've been talking with Dr. David Minkoff about Perfect Amino, the protein that you can get to help heal your body, and his company called BodyHealth. You can get there at BodyHealth.com. And thanks so much, David, for giving us all that useful information to help everybody heal. And I'll post a lot of this on our webpage, drfrankcuttingedgemedicine.com. So until next time, stay healthy and eat the right stuff. Get some exercise. All right, we'll talk with you later. Thank you, David.
Thank you, Frank. Bye.
Bye-bye.